It's cold and flu season. Everybody knows that. I don't know what it is about the winter that it's always cold and flu season. And that's one of my questions today for my guest. Why is it cold and flu season? What can we do about it? Why haven't they cured the common cold yet? And what can we do when we get a cold to make us feel better in less time? So if you want to know more about this, I know I do. Just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. My guest today is Dr. Violet Kramer. She is from Monmouth Pulmonary Consultants in Eatontown. And you know what? With all the doctors that we have had the good fortune to speak about Dr. Kramer, we have never spoken to a doctor from this particular practice, a pulmonary doctor. So kindly introduce yourself a little bit and tell us a little bit about you and what is a pulmonologist?
Well, thank you so much, Andrea, for having me. And thank you to your organization for all of the amazing things that you do. Um, we really were made to take care of each other. So this is a great opportunity. So I am Violet Kramer. I am a pulmonologist, which means that I see patients who have various lung disease. So one of the most common things that folks will come to me for is a chronic cough. But also, of course, patients who have are then diagnosed with or previously been diagnosed with asthma or COPD. For former smokers, sometimes they'll have a screening scan and be found to have a spot or something, so they will come to see me. So a whole host of conditions, again, cough being very top on the list, and then shortness of breath. It is true that especially us ladies, it's Heart Health Month. Sometimes it's cardiac, but yes, sometimes it's pulmonary too. So seeing a lung specialist, we're happy to help.
And of course, we'll have all of Dr. Kramer's contact info in the show notes should you want to see her or know more about what she's doing. So, Dr. Kramer, let's just get right into this. What is it about winter as opposed to spring, fall, or summer that really does make it cold and flu season to such an extreme?
So part of it is that we are so tightly packed in the cold.
Okay.
Um, so there's just not as much air turnover, and we love the kids, but they've gone back to school. They share the germs, and they bring them home. Additionally, when it is colder, some of our upper airway defenses, kind of the usual healthy mucus that we have that coats our nose and sinuses, it can either dry out or as a reaction to the cold become more well, we all know we have runny noses and when it's cold, right?
Yeah,
So
yeah.
sometimes it just doesn't do as good of a job at kind of being that first layer of defense for colds and flu viruses. And then, of course, when your nose runs, it's very tempting to want to go at it. And if you've recently touched a surface that someone else has touched who's sick, it's very easy for it to spread. So
So those germs do have a way of spreading like wildfire, don't they?
they sure do. Um, uh, and a lot of our, especially our asthma patients and our COPD patients, I think many of them are already well aware of how important it is to try to stay back. Not that we want to keep people at home isolated, but if someone calls and says, "Yeah, I have a little bit of a cold," but you can still come over. Sometimes they'll say, "Well, maybe we'll put the brakes on this for a day or two until you're feeling better." Um, I would love it if more folks, when they felt unwell, when they're in public spaces, would wear a mask, partially because it does provide some protection, but also it's a really nice physical reminder not to touch your nose and your mouth and your eyes.
And at least if you're in a public space, could you cover your mouth or your face when you sneeze or you cough?
That is a really good idea. A lot, and I learned this actually from the kids that sometimes coughing in
Yes,
your elbow
yes.
instead of with your hand, because then the hand any of us, we're human, we touch things. It's very easy for that to go somewhere else. So.
So, who is, let's say, all right, so we understand that you you might get a cold. Who's most prone to getting a cold? Like, I don't know if it's an age group, a certain demographic, but everybody gets colds. But in this time of year, who is most prone?
So I would just put a little nuance that I would say that the folks that seem to get the most more severe symptoms are those who are in our older age groups or who have other underlying conditions, such as, maybe they're on a medication that suppresses their immune system, or maybe who have underlying lung disease. And sometimes we don't know that we have underlying lung disease. We just say, oh, it's just a cough that, happens every year for several weeks. But perhaps that is a little tendency for reactive airways or asthma-like condition, or, you know, folks who maybe smoked, they stopped smoking years ago, but of course their lungs remember. And so then they develop this tendency to have not just simple cold symptoms, but a cough that lingers for weeks and weeks. There's
Yeah,
things
and
about
that's not
that.
fun when when your cough is lingering. That is, and I'm always interesting to me people who say, "Well, it's just a little cough. I've had it for a while. I'm not contagious." But why have you had a cough for so long? What are you going to do about it? That's
Right. Well, and
see somebody.
that is sometimes an interesting line when I'm just in, my day-to-day life, out in the community and not wearing my, white coat or say doctor hat. If I notice that someone's coughing, I'll try to just be very casual about it. Gosh, it sounds like you've been coughing for a while, how's that going? Or I'll say to one of their friends, you may want to suggest that they see someone, not again, not because I'm looking for everyone to come and see a pulmonologist, but when a cough has persisted for, say, more than 4 to 6 weeks, it does warrant a look in because, well, partially, it doesn't have to be like that. It is true that some folks will just have a chronic cough, but there's often things that we can do. And peace of mind
Right,
is
right.
well worth the effort.
Not to mention you're annoying everyone around you with that cough. But now a lot of times I'll hear people say, "Oh, oh, I have the flu." Or I think I have strep, self-diagnosing, or maybe they consulted Dr. Google. He's very popular. But how do we differentiate? Do we have a cold? Do we have the flu? Do we have strep?
So some common symptoms of the flu versus a more simple cold. Again, although cold can give very severe and very unpleasant symptoms, I don't want to minimize the simple cold.
Yes.
Um, but flu symptoms often include feeling achy, fevers and chills, sometimes some GI symptoms like some nausea or loose bowel movements. And the reason why distinction is so important is that we do have medications to help decrease the severity and duration of flu when it's taken early. So I think that is helpful
So
to
would
know.
it be prudent if, okay, I have a cold, or in my mind, I have a cold, and is it worth calling your doctor to check? Is it more than a cold?
I think so. There are some, especially if there are some warning signs. If you know that you have underlying conditions, or if you are having actual difficulty breathing,
Right.
or especially if you're feeling very, achy and tired, more so than usual, those would be reasons to call. If that little voice in your mind is saying, gosh, maybe you should go get checked out physically, maybe even in the ER, listen to that intuition. But in the meantime, yes, it makes sense to call your doctor because sometimes, again, if it does seem flu-like, sometimes if it is so typical and we're deep in flu season, folks will just prescribe flu medications. That's reasonable. But there actually are, and I have no stock in the companies, There are over-the-counter flu tests, which I was very excited about when I saw
I
them
see
on the
that. I
shelves.
see them in the drugstore. I do see
Exactly.
that. Yeah.
I
Hmm.
think that's helpful to know.
So, all right, you've been diagnosed with a cold. It's a
Mhm.
cold. I know we can't take a magic pill and make it go away, not yet, but what should we do? What are some of the best things to do to make the cold, to at least alleviate the symptoms and make ourselves more comfortable?
So first of all, most important is to rest. Now, I'm not saying to take to bed and not move for
Right,
days at a
right.
time because that also
For
is not
some
good
people, that's
rest.
how they rest. Yeah.
Yes. So make sure that you walk around a little bit, but plenty of fluids is very, very important. Unless, of course, your doctor has told you that there's a reason that you need to limit your fluid intake. But basically, that humidifies your secretions so that your cough is going to be more effective and keep things from settling down in your lungs. Um, so some of the over-the-counter medications, they can give you some temporary relief in decreasing your sensitivity to the cough. I will say though that the data does not show that they are definitively helpful, and I'm always very mindful about the potential side effects.
Right.
Angie, I don't know if you've ever taken Benadryl, but I know that when I take Benadryl, I feel otherworldly. So imagine
I know it,
if,
I got that. Yeah.
so I'm just, and I'm not saying don't ever
And
take
not in a good
Benadryl.
way. Yeah.
Right, exactly. So, and I'm not saying never take it. There's reasons to take it, but I think it's important to be mindful, especially if one, takes like an antihistamine that, could potentially be sedating. Just be mindful of your environment, especially if you're unsteady to begin with. So, and then the other thing to keep in mind is a lot of the over-the-counter cold remedies, anything that says that it's a decongestant is often going to increase your blood pressure. So a few years ago, one of my very dear friends, a nurse, we were kind of talking about over the cold remedies. He said, "Oh, try X," and I wasn't specific enough. And she got the one with decongestant, and she called me later and said, "Oh, my heart is racing. What is this?" And I said, "Seems like you're very sensitive to the decongestant part of it, and I would just be cautious. It's okay if you don't have underlying, blood pressure issues to take it maybe for a day or so if it gives you some symptomatic relief, but I would just be very cautious." Another thing that often comes up is the nasal sprays that are decongestant in nature. And there is nothing like it. You spray it in and you can breathe through your nose. But those also work with the same mechanism. They can increase your blood pressure and perhaps make you feel jittery. Additionally, if you use those decongestant nasal sprays repeatedly, when it wears off, you have even more nasal congestion.
Wow.
And yeah, yes, and it is really uncomfortable. And a few of my patients, it's really been a struggle because it's very hard to go through that kind of withdrawal syndrome where your nose is so stuffy you can't breathe through your nose.
So listening to you, I'm thinking to myself that, like so many adults who are on some medication, that if you're buying something over the counter in the drugstore, maybe you should talk to the pharmacist first. And because hopefully it's that drugstore where they dispense your medications, and maybe the pharmacist would give you some insight about don't take this, but maybe take that.
I think that is a wonderful idea. And I'm smiling because my father was a pharmacist, and that's one of the things that he enjoyed most about his job was giving that type of counseling. So that is a really good idea. The pharmacist.
I think for a lot of people they don't understand what a good resource your pharmacist is, because if the pharmacist knows all your medications and you're grabbing this or grabbing that over the counter, maybe you're making a bad cocktail of medications. So I like that idea too. Talk to the
Yes.
pharmacist. So, in your professional opinion, I'm going to really put you on the spot. When are we ever going to get a cure for this cold? I mean, don't people ask you this all the time?
They do. Well, I don't see it yet. So,
Like it's not
um,
on the horizon.
not that I have seen in the close horizon. And part of the reason for that is the viruses that cause the common cold, although again, not so common feeling, um, they change very frequently. So if we say make a vaccine for one, the virus is going to very quickly change so that your immune system won't be as effective of the next iteration of that virus. So flu is, I mean, we hear about it every year that, oh, does the flu vaccine match? And some years are better matches than others because the flu virus also changes. But we can see some efficacy of the flu vaccine, even if you see in the news that it's not a great match. It may not keep you from getting the flu, but it may decrease your chance of having severe flu symptoms like being in the
Okay.
hospital. And I do want to just go back and add one thing about, when should you call your doctor and seek help? Also putting on my hat when I work in the hospital, I always want to be mindful that it is possible to have sepsis-like symptoms from cold or the flu when you have a virus to begin with and then you start having actual pneumonia on top of it, or even from the flu itself. So if you or your loved one say, gosh, you're not quite acting yourself, it's because they love you. That is a reason to go get checked out.
So, for how many days after a cold, kind of rears its ugly head, would you say that this is a bad sign and maybe I better get checked out?
So often the pattern that we'll see is that folks will actually be starting to recover a little bit. So unfortunately, several days in, a cold symptoms, although they'll decrease, can last for 1 to 2 weeks, if not sometimes a little bit more, and be normal. But let's say that someone is starting to feel better, but then all of a sudden they feel much, much worse. That is a sign that there could be something else that has kind of come on top of it and a reason to call your doctor. And if you're really unwell, just go on over to the hospital or the urgent care ER will figure it out.
So, what about the idea? You talked about drink plenty of fluids, get some rest, but not taking to bed for 10 days. That's not rest. I don't know what that is. That's just giving up. But, the old chicken soup, having maybe taking some aspirin or Tylenol. Are these still the time honored things that we would say to people?
Yes, I think good old so Tylenol to help with fever and some of the muscle aches, very good. Some of the other pain medications, I would just make sure that you're aware. Next time you with your doctor, gosh, if I have kidney issues or blood pressure issues, is it okay for me to take things like ibuprofen? But Tylenol or acetaminophen is helpful. Just don't exceed the dose that's
Right.
recommended on the bottle. If you find that you are taking the maximum dose of Tylenol, though, for several days in a row, another reason to call your doctor. And I think I got so into the medications. Let's talk also about tea and honey. It is very soothing and
Very soon.
a
Yeah.
good idea. Yes. And chicken soup. I don't think that I can give you a placebo-controlled trial with chicken soup, but it works. I'll give you my anecdotal experience. Yes.
Right, right, right. Of course, of course. You should always have some in the freezer ready to go in
Right.
case you or somebody comes down with a cold. That's how I was brought up.
Yes.
Well, Dr. Kramer, thank you for so much good information. We're laughing. A cold is not funny, and I know that. And at some point, everybody gets one. And the idea is that if it's lasting too long, you should see your doctor, or if necessary, go to the ER. But is it would it be fair to say that for most people it's just an unpleasant experience that we just have to get through it?
It is, yes. And when what you said about the chicken soup, so at the beginning of our conversation, I was talking, avoid others, and it's true. I don't want us to share our germs, but having a cold or being sick, it's incredible what folks in our spheres will do. It's the best of who we are. Someone will show up with a chicken soup, or at least, share, oh, I have a magic soup recipe for you. And it's, I, again, let me banish colds immediately. But as we take care of each other, I have to, just, I'm in awe of how good we are to each other.
We do have it in us. We absolutely do. All right, Dr. Kramer, much appreciation for being with me today and talking about a subject that touches everybody out there. I know it does. So take care of yourselves, everybody out there. And again, thank you so much. Remember, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone, and bye, Dr. Kramer.